If you're looking at having a hair transplant procedure and just are worried about, oh my God, it's going to look so obvious and everyone's going to know, well, stick around to find out more. Hi everyone, welcome back to the show. Thanks again for watching, and please remember to like and subscribe to the channel. It really does help us out. So if you're planning on having a hair transplant procedure, one of the things that you may be concerned about is, well, what is the appearance going to be like, both in the short to medium to long term after the procedure? Well, first of all, let's deal with the long term, because that's the easy bit. Well, that's the bit that you're looking for, right? You're looking at creating potentially a new hairline, or you're looking at filling in an area that doesn't have the density that you want. So that's the bit that we're going to focus on to try and achieve. So make sure you speak with your doctor about that and create a hairline that is naturally and age appropriate for you. Fill an area out that looks in uniform density with the surrounding area, and make sure that the doctor's taking care of direction and angle of the hair. All right, so that's the first thing. So that's the end point. Let's talk about the beginning part. Well, what is it going to look like in the short term? Well, we've got to divide it into two sections, because we take the hair from the back and we put it into another area, maybe the front or maybe the crown. All right, so we can divide those sections into two, the donor area and the recipient area. Now, in many cases, if we're performing FUE surgery with the donor area, we're going to shave the donor area. And so in that regards, it can leave you with an obvious looking short-term result, because if you're not used to shaving the back of your head, then that can be quite obvious. There is going to be tiny little dot-like scars at the back, but they heal up very quickly, and within a couple of days, you're brushing off the scabs at the back. And within about 10 days to 2 weeks, generally there's sufficient growth that you see that it doesn't look like you've had anything done. And I see my patients at 2 weeks, and I'm always shocked how good the donor area looks like. And again, it comes down to technique as well. If you're over harvesting from the donor area, then of course it's going to look bad. So make sure that whoever's doing your procedure is taking that into consideration. And then there's the recipient area, right? So where you're transplanting into. And what we're going to do is we're going to be transplanting tiny little stubble hairs, generally speaking. And there's going to be a bit of redness and crusting there that's going to last about sort of between 4 to 7 days. And after that, you brush off the scabs. So yes, it can potentially look quite obvious. If you are creating a new frontal hairline, for example, you are going to see that in the short term. After that first few weeks, you're brushing off all the scabs, and within the first month or so, some of the hairs will also fall out, which may make that frontal area appear a bit more obvious. And there are a variety of different ways to handle that and address those concerns. Some people wear a cap, or a baseball cap, for example. Some people will shave their head, will just continue shaving their head until they get towards the end point of the growth phase of the hair transplant, and then they'll just let everything grow through. The other thing to consider is that, especially if you're doing work in the frontal hairline, this is what we call a very vascular area. There's a large amount of blood supply. So there's a tendency for swelling to occur. Now, a lot of the things that we do and the way we practice currently, we try and minimize the swelling as much as possible, but that can be, it can happen, and it's not a problem. I mean, it will go by day 3, day 4, and doesn't affect the grafts one bit at all. So there may be a bit of downtime associated for the individual. So got to take that into consideration. So that's the short term. Then the medium term, what happens? Well, like I said before, in the transplanted, in the recipient area, some of the grafts will fall out initially, and so it can be quite patchy, and you don't see much happening for about 2 or 3 months. And that can be a point of frustration for many people, because they're not seeing the growth. But at month number 4, it starts to come through, and at 6 months, it goes guns blazing, and really about 60% has come through. So you're really seeing good growth in a relatively short period of time. And then the rest of the growth happens over the next few months after that. So these things I need to take into consideration. One thing to mention is that that's if we're doing FUE types of procedures. There are other types of procedures that you can do that manage the donor area in a different way. So there's FUT surgery, in that you only shave a small strip of what you're taking away and you're cutting that out and you're sewing that up. And that will, however, leave you with a linear scar at the back of the head. But there is also a newer technique now. It's called long hair FUE, and we're doing that more and more frequently for larger cases as well. So we can do up to about 2,000 grafts in a single session with long hair FUE. And long hair FUE allows us to harvest the hairs at the back of the head whilst keeping the hair long. And so the associated downtime with this procedure is a lot less, because people can return back into sort of public life in terms of meeting friends or meeting work colleagues without the obvious apparent nature of having a shaved back of the head. So if that's something that interests you, then make sure that you speak to your doctor about if that service is available or not. So I hope you found that useful, just to sort of highlight and give you some information about the concerns that people have about how apparent the outlook or the look is of having a hair transplant procedure. Again, thanks for watching, and we'll see you on the next episode. Take care.